Good day and welcome to ASOKA Services YouTube channel, where we translate health policies to data. On the previous videos, we had discussed about data elements and indicators. We had looked at where these come from and how they impact on us as healthcare professionals. If you missed this video, I will have a link on the below this video. National data indicator sets, we discussed them at length and who's supposed to collect them, which point and how. On this video, we will be talking about the registers, collection tools that are used to collect these data elements or indicators. There is a number of registers that we find at facilities, and these registers are used for different purposes at different times. We will cover these in this video. We start with the PHC Headcount register. This register, as we said, is a source document for all these data elements that you see. These data elements basically are counting the number of patients that are coming through the facilities and breaking them down to age groups. When these data elements are collated and captured onto the HIS, they then measure the indicator, headcount indicators, as you can see in number 2. As we had said before, indicators not collected at facility level but are calculated automatically within the HIS using the population for that age group for the area that the facility is rendering in this case. So the PHC headcount data elements will be collected and the headcount indicators would then be calculated when the data is captured onto HIS. We had discussed in the last video as well that each data element here will have a definition in everything and who collects it and the context and everything. In this case, for the PHC headcount, the context is to measure the data element monitors the access and utilization of the PHC facilities for different age groups, as we have seen in the previous slide, the breakdown of the data elements, and the indicator measures that for the whole population. It measures the number that have come to the facility against the population numbers in that age group for that catchment population. It is collected at the reception by the receptionist or the data capturer or the data clerk. As we had said before, most of the data elements are collected at the point where the service is being rendered. That's where the data element will be collected. It is collected, as we have said, in all PHC facilities, not in hospitals, because it is a PHC headcount. The tools that are being used to collect this data will be the reception headcount register that we are discussing, as well as the HPRS if the facility is using an electronic system. We then look at how this PHC register, headcount register, looks like. We've just taken the top part of the register. Those are the columns that you'd see in the headcount. It captures the patient's name. Obviously, we have to put the month first because each month will be different, so that when we collect the dates, we do not mix them. So it will collect the date, today's date, the patient's file number, name, and ID numbers, which would then also give us the date of birth and everything, nationality, physical address of the patient, and their contact numbers, sex or male. And then it would then take the breakdown. You have to calculate the breakdowns as per data elements as to the PHC between less than 5, between 5 and 10, and 20 and above, as we have seen with the data element. Some part of the register looks like this. After the register, each page has been completed, then you count and you give the total. As you can see on the far right, you give totals per age group, and these are the totals that will add up to the monthly one. As you compile the register, there will always be the name and the signature on your left for the people that compiled signature and their date, as well as the one that verifies them. And then this takes care of the PHC headcount register as a collection tool. We then look at the PHC Comprehensive Register. This register talks to the data elements that are related to healthcare services that are being rendered. As we have discussed before, most of these data elements are rendered by clinicians, are collected by clinicians, as they are the ones that collect or render healthcare services. Remember, we said that data elements are a way of measuring the implementation of different policies within the healthcare system. So these healthcare policies will be in the form of guidelines or policies or memos or any initiative that the department puts in place. And all of this data is then collected as per needs. So the PHC Comprehensive Register collects data in line with the needs, as we have said, on all healthcare services that are being provided in the healthcare facility. As we can imagine, there's a number of healthcare services that are being rendered in the healthcare facility. So, if the healthcare facility provides healthcare services, and that means the bulk of the data is then generated through healthcare services, and these healthcare services are rendered by healthcare professionals. Does it then mean that healthcare professionals collect healthcare data? This is one of the biggest discussions that always takes place in our clinics. If you remember, when we were discussing the PHC headcount register, or even in the previous videos, we said data elements are collected at the point where the services are being rendered. We can discuss this below in the comments below, or in another platform, or maybe in the videos that would come. With NIDS, there's over 400 data sets that are there, which is your both the data elementers and indicators together. More than 60% of these are in line with the healthcare services that are being rendered, which makes sense because healthcare facilities provide healthcare services. So it only makes sense that the bulk of information that we collect from there will be healthcare services related. So are our clinicians doing clinical work, or are they data collectors? That is one of the things that is linked to, do I just do clinical work or do I collect data as well? But if you remember as to what is the basis of all of these data elements or needs, is to measure the healthcare services that we are rendering, then it would make sense that the person who renders the service then collects the data, because then it becomes a true picture of the services that was rendered. Let's look at the PHC Comprehensive Register. This is how the register looks like. It is supposed to be in every consulting room that a patient comes in to access services. There is a number of data elements that are in this register. Let's look in this register in more details. You can see on the far right, you won't see everything, but basically there's a bigger part that is just squares with the fine writing above it. Basically, that's where the ticks will come in. Let's just look at this register in more details. Let's start with the far right. This is how the far right looks like. It is basically measuring who is working. Is it a doctor or a professional nurse? And if it's a doctor, then they would tick if it's 1 day, 8 hours, or the same as the healthcare professional. If you look on your far left, below the facility name in the area, then there is patient details there. For every patient that we see, we then have to put in the date that we have seen them, the file number, and the patient name and surname. Next to this block of patients' name and surname, we have a group of data elements that we have magnified on top there. It takes the same format as the data elements that we have seen in the previous videos. Basically, it groups the data elements into group of services that are being rendered, being EPI, PHC management, HIV, TB, I or CCMDD. And below this block of groupings for data elements, you then find the individual elements. These data elements are basically aligned in line with the group or the service that the patient will be accessing. So you will have different data elements in each group of data elements. These data elements, the basis for them, as we have discussed before, are the NIDS, the National Indicator Datasets. If you look below the patient's name and surname on your far left, you then find out of the total. For every page, there is a portion to total the ticks that the clinician does per area that the patient has come. So the clinician will then will write patient's name, patient's details, and put a tick on the service that the patient has accessed. And when the page is full, then these are totaled per column, so that we know it's 5 that came for HIV, it's 2 that came for rehabilitation services. And on the far right, it then gives us signatures or responsible people for this who compiled this, which should actually be your clinician that has seen the patients or that has ticked the register and who verified it, as well as the information officer space there. So this then, once it's added up and it's verified and it's collated on a daily basis, the facility can compile a weekly PHC comprehensive summary report from them, which is one of the collection tools that come with the NIDS 2020. This is how this register looks like. It's basically the same as the comprehensive register that is in the consulting room that we just discussed. It's just that it collects this data that the clinician would have summarized, and it was verified by the operational manager as well as the information officer. Then it collects it on a daily basis and give a total for the month. If this is done correctly, it would then provide a summary for the facility for that week. As you can see, you also have the name of the person that compiled this report and their signature, as well as who verified it, as well as the date that all of these were done. If this is done correctly, then it would make it easier to collect the stats on a monthly basis. We have also discussed that not all of the data elements are on the PHC comprehensive register. For example, those small blocks in the register that we just discussed, the PHC comprehensive register, only covers 98 data elements, and 110 of these data elements are on some of the electronic registers that we get. This could be tier.net or smarter in some of the provinces. About 18 of these data elements are reported monthly, and 92 of these are reported on a quarterly basis. That is, we are able to generate quarterly reports from them. This electronic register that we have, that we will discuss on this channel, will be tier.net. If you look at tier.net, it actually captures information for patients that have attended the HIV testing services, those that are started on ART or are accessing the ART services, as well as the TB clients. And for this register to actually capture information as is needed, it needs a collaboration between both the clinician and the data capturer. Remember, the clinician sees the patients or renders the clinical services, and they would write all of this information on their clinical notes. So the status of the clinical notes, how complete it is, how comprehensive, will the data capturer be able to understand what the clinician has rendered to the patient, does matter a lot. The folder flow also matters. After I've seen the patient as a clinician, what happens to that folder? Does it end up in the capturing point for it to be captured on tier or not? Remember, if it's not captured on tier, it's the same as if the services were not rendered when it comes to the report. So if there's no notes on the clinical notes, then there won't be any capturing on the electronic register, in this case tier, as the data capturer will not know what services were rendered. No capturing on the electronic register then would lead automatically to underreporting. The monthly PHC register is a summary of all activities that have taken place in that facility during this month. It collates data from all of the registers or collection tools that we have discussed in the previous slides. It will look at your PHC headcounts. It will take your comprehensive register, even the weekly one if it's being used. And it will take some reports that you run from TIA or even smarter. And any other resources or sources that are not in the scope of this video. This would include like any other pharmacy or medication reports or collection tools that might be at the facility. So basically the monthly report, it takes all the data elements that the facility reports on in all the different collection tools, in all different spots or areas in the facility, and collate them onto this report. This report is also then broken down according to the data elements grouping, and it also gives a summary or a guide as to what numbers to take, what not to take in each facility. We will not look in detail on this report, on this monthly register, but we have an idea that it is fed by all of these collection tools that we have discussed before. When this report then is completed and it's signed off like any other of the reports that we have seen on the weekly one, and it's verified by the facility manager and the information person, then this data then it's reported on web DHIS, and it's accessible to all levels within the national healthcare system. And it can also be used to verify or provide reports as needed, as we have discussed in the previous videos, by the Auditor General, by PFMA, or even measure services that the clinic is rendering to the community. Thank you for watching this video. In the next videos, we will try and look at more specific areas and would incorporate both the data element, the collection tools, as well as the register that is being used, as well as the clinical notes and how it affects the reporting of these services. So if you want to be notified when these videos come out, please subscribe to my channel, like it, and share it with the others. Thank you.